Module 2 is Operations. In this video, you will learn and take a test of the following: vehicles, daily operations, appearance, scheduling, professionalism, and interaction with passengers. This slide is our smaller transit vans. These vans have a fold-out ramp. The rear space in this type of vehicle is fairly small, so we cannot transport bariatric patients in the Sprinter vans. A bariatric patient is a patient that requires a larger wheelchair. Only average-sized wheelchairs will fit in the back of the transit vans. We will transport all patients that are in the motorized wheelchairs in the Sprinter vans. You will wheel the patient up the ramp, apply the brakes, and connect all safety straps.
Here's a picture of our large wheelchair vans. These are used to transport regular sized wheelchairs or extra wide wheelchairs. We do not transport power chairs. We also do not transport car patients. It's too much of a liability to have a car patient climb in and out of the front seat. If you would go to a patient's residence and somehow by mistake you would show up and they would be in a power chair or in a car, you need to call back to dispatch. That way we can arrange the appropriate transportation to pick up the client. Wheelchairs. Here are the different types of wheelchairs that you will be transporting. To the far right is the manual standard size wheelchair that will be taken the majority of the time. The left in the middle also is a picture of the power scooter and the motorized scooter. And again, these must be transported in the little small Sprinter vans. The wheelchair on the far right is the wheelchair that can be transported in the small Sprinter vans and also the large van.
As an ambulette driver, you will only have two different types of transportations. We have the wheelchair transportation as well as our car service. Car service is used to transport Medicaid clients to medical appointments only. These passengers do not require a wheelchair. This is a door-to-door service. You will not wait with the passengers at their doctor's appointments. You will pick the patient up and drop them off at the door of the appointment. These clients are typically able to walk without assistance. When the patient is done with their appointment, they will call us to transport them back home. Once the passenger is in the car, they must wear a seatbelt before you can depart. Never take a patient unless the seatbelt is on. No transportation can take place without the patient being properly secured. If the passenger refuses to buckle up, call dispatch, and we will make other accommodations. How our day-to-day operation works. Every day, schedulers form the next day's schedule on a spreadsheet. Every day, the amount of runs vary, and where the runs are at vary as well. End times will vary on a day-to-day basis. The scheduler, Misty York, will add as many drivers as needed to cover the scheduled runs for the next day. If you are available for the next day, you have a chance of being called in to work tomorrow's shift. Our nightly wheelchair dispatcher will call everyone that is on the schedule for the next day and give you your end time. To be safe, always call in around 1800 to make sure you are on or not on the schedule. It is your responsibility to call dispatch and receive your time.
Appearance. All the employees are to always appear professional. You must always wear the PZ uniform, which consists of navy pants, not black pants. You can purchase a zip-up sweatshirt, a jacket. You must wear a black belt, black shoes, any type of hat or jacket. It must say Portsmouth Ambulance. This is due to having contracts with different facilities, and you must be represented whenever you're going in and out. If you have a beard, it must be kept clean. No shaggy beards. Earrings are to be stud only, no loops. All shirts must be tucked in, again, with your black belt. And again, always remember to look professional. EMTs, paramedics, and ambulance drivers are all wearing the same uniform, and you're all being looked at by the public. Again, always look professional. All EMTs, paramedics, and ambulance drivers will all be wearing the same uniforms, and we want you all to represent Portsmouth Ambulance. Here's a picture of how the uniform would look in the wintertime. You can see that he has on his navy pants, his black boots. He has on a Portsmouth Ambulance hat as well as a sweatshirt. Again, remember, Just purchase all uniforms through Portsmouth Ambulance, and you can't wear anything if it does not have the company emblem on it.
The characteristics of a professional. Each is specially trained for a job, required to have special skills. You are required to meet licensing standards, and you do provide an extremely valuable service to the community. The final characteristic of a professional is to have high level of performance at all times. Because it's easy to be positive, feel good, and treat others well when everything is fine. The difficulty comes when things are not going well. This is the true test of your skill as a professional. Interaction with passengers. Of all the things you do as a transportation vehicle operator, the way you interact with your passengers will have the most influence on your job and the future of your agency. We are a company of high standards. Our main objective is to always be as quality and caring of a service as possible. We'll only have drivers out on the roads that are willing to always be that caring and compassionate person for your patients. If a patient wants you to be their driver, we will assign you to that patient. In the same respect, if they do not want you to be their driver, we will not send you to that patient. All of this will correlate with your amount of hours worked and position in the company. If you do not display a caring attitude to your patients, the patient will let us know, which will directly result in the amount of trips that you will be given. So always ensure your hours, be the best person possible to all of our patients, because they deserve it, and it will better yourself in the process.
This slide talks about the center of gravity in a wheelchair. This is just saying if you're going around turns, the wheelchair is prone to tip. So whenever you are driving in your vehicle loaded with your patient, whenever you're going around these curves or you're traveling, you must travel cautiously, at the speed limit, below the speed limit. There is no reason to be in any type of rush. And as long as you take your time, you'll get there and your patient will get there safe and sound.
Driving techniques. Centrifugal force, which is the outward force, is exerted on wheelchairs when your vehicle turns a corner or takes a curve in the road. Regardless of the direction of the turn or curve, the passenger may feel as if they are being pulled forward out of the chair, or that chair may tip over. Therefore, slow, steady turns and curves must be made. When you're out on the road, remember, a patient is sitting in the back in their wheelchair. Therefore, slow, steady turns and curves must be made. Always be slow and courteous and think about your patient in the back, for it will be scary to them to be sitting in the back of a wheelchair whenever the car is moving at high speeds.
Moving clients in wheelchairs. Whenever you're pushing clients maybe down a hill or over a little grade, you should always pull them backwards. The big wheels are the ones that are used to go over bumps or down curves. The little wheels up front are not meant to do that. So if you're trying to push someone, into inside a facility and you're pushing them forward and those little wheels hit the metal plate, you have a tendency of the possibility of dumping someone out. So always, that's why when you see someone going in and out of doorways, they normally turn the patient around backwards, take them in backwards, and always remind your client to keep their elbows in. That way we don't accidentally bump any elbows.
Something's not going right. Always call your supervisor or dispatch when things are not as usual or if your agency policy is being broken. Please do not attempt to make a judgment call on whether or not you should do something. Always call your dispatcher. They are experienced in helping their drivers make decisions. If they do not have an answer, they will ask administration. We always want to make the right decision on problems, and by being inquisitive, you will become a better employee for the company. Lifts. Lifts are potentially hazardous equipment. They must be maintained and operated properly. Considerable caution and awareness is needed when operating a lift. Only the vehicle driver should operate the lift. Lifts. It is the responsibility of the vehicle operator to properly open, secure, and close the lift doors, to load and unload the passengers on and off the lift platform, and to properly use all lift functions. Open the lift from outside of the vehicle, securely lock the doors in the open position.
Manual raising of the wheelchair. Below is a picture of the how you would lift a wheelchair manually. Say for some reason the hydraulic lift go out. The chances of it happening are very slim. I think this has happened maybe 2 times in the whole career here that I've known. It's just an accident. So if a hose or something would bust, everyone needs to be made aware how you would lift the patient out using the hand crank. When you guys are doing your orientation and you're in the big vans, always ask the person you're with to show you how to do this. You might not be assigned to this big van, but for some reason, say you have a flat tire in your small Sprinter van, they place you in a big van, everyone needs to know how to do this. According to the ADA, securement locations shall be placed as near the accessible entrance as practical and have a floor clearance area of at least 30 inches by 48 inches. This is highlighted in red because it's very important. Please do not lower your lifts down if you do not have a space this big.
Safety locks. Each system includes a minimum of 4 floor-mounted belts and a lap and shoulder belt. The manufacturer of each system states that all belts shall be utilized each time the system is used. You must never forget to apply any safety measures when you place your patient in the back of the van. If any one part is left out, you have left your patient in extreme danger of injury. Forgetfulness will not be tolerated in applying your safety measures to your patient. This must be completed any time a patient is in your vehicle.
Placement of the wheelchair. The wheelchair and the occupant must face forward. They cannot face the rear of the vehicle or the side of the vehicle. The wheelchair always needs to be placed in the center of the floor plate so the tie downs can be tied to the appropriate locations. And apply the wheel locks on the manual wheelchair and then turn off any power on the motorized scooters. Front strap procedure. Below are pictures of the appropriate placement of the front straps. The front straps are to be placed on the outside of the front wheels, 3 to 8 inches outside. You can see the red strap pictured below. Whenever you're placing these, you have to pull that strap out and extend it. That way it will lock. If you do not extend it, and you just hook it on a wheel, if you were to get in an accident, it is not going to have this wheelchair secure and the wheelchair will go flying all over the place. So please remember to pull those out and strap them appropriately to areas that are non-removable. You can see in the picture they're not placing the strap on the wheels. They're placing it on the frame of the wheelchair that does not come apart. Also, these are supposed to be placed at a 45-degree angle, not a 90-degree angle. The rear straps, which we do not have pictured, I do not have a slide, are supposed to be inside. So they're inside the 2 wheels. So you don't want them coming from outside like pictured below. They are inside. And then they also need to be placed on an area of the wheelchair that is non-removable, which like the frame of the chair. Cautions. Again, do not attach the straps to the wheels or any part of the wheelchair that can be removed. For example, the armrest. They can be removed. Again, do not place the strap there. It needs to be at a 45-degree angle to the frame of the chair.
Thank you for watching the video. Please take the quiz for Module 2.